Good morning, and thank you to the committee for this opportunity and the invitation to present a little bit of information about, to speak in favor of the Keeping All Students Safe Act, and specifically to prohibit and prevent seclusion and restraint, and to prevent and reduce the use of physical restraint in schools. I applaud your interest in this act and its important benefits to children, adults with behavior and mental health challenges, their families, and those educators and other professionals who support those individuals for their improved quality of life. Over the last 20 years, with the support of the U.S. Department of Education, I have been in the fortunate position of being able to develop a framework called Positive Behavioral Interventions and Supports, and I will reflect a little bit upon that as part of my comments. I refer you to the Technical Assistance website for PBIS at pbis.org for more in-depth information. And as mentioned, I've also submitted a more in-depth written statement for you to look at. I also want to ask you to please reflect back on some of the other testimonies that have been presented in the past, because there's some great information about this particular issue that has not gone away and will continue to be in front of us. So I encourage you to look at those. I also encourage you to look at many of the position statements that have been provided by professional organizations who have the same concern about supporting kids and families that have issues around restraint and seclusion. And they have done an excellent job of summarizing the situation. In the remaining portion of my time, what I'd like to be able to do is emphasize four messages. The first message is that every student and educator has the right to a safe, respectful, effective, and constructive learning environment, especially students who are high risk for developing challenging behavior or have histories of such behavior. Second thing I'd like to communicate is that restraint and seclusion is not a therapeutic treatment, intervention, or practice. Third main message is that effective, empirically supported, relevant tools, practices, and systems are available for achieving safe, respectful, constructive teaching and learning environments, and some of the other witnesses will reflect upon those. And fourth, efforts like this act are needed at the federal level to increase and maintain our focus on ensuring that we have the motivation, capacity, and opportunity to protect all children from harm at the classroom, school, district, and state levels. So in support of those four messages, I would like to highlight a couple considerations. First is that restraint and seclusion, as I mentioned, is not a constructive treatment, intervention, or therapy. The evidence is clear that students who experience restraint and seclusion do not learn proactive skills. They do not develop or maintain positive relationships with others. They do not enhance their capacity to function in more normalized environments, and do not restore environments and relationships with others. Second, restraint and seclusion may be required for a small number of crisis emergency situations where the potential for students to harm self or others is imminent. Restraint and seclusion should never be used as a means of enforcing rule violations, assigning punishment, or forcing compliance. Third, challenging behavior does not occur in a vacuum. It occurs in a social context and interactions with others, and typically is at the end of an interaction chain, and that's an important message to remember. Fourth, students who are high risk for developing challenging behavior or have such histories must be provided preventative and constructive supports. Having reactive procedures in place is a good thing, but it's important to be thinking about how do we anticipate these in the future. Fifth, school, district, and state leaders must provide multi-tiered organizational policy and procedural supports, like PBIS, for example, that enable educators to be effective in preventing and responding to problem behaviors, including restraint and seclusion. Sixth, educators, family, community members, and other professionals must have opportunities to develop high levels of implementation fluency in the use of effective behavior support practices for all students, but especially students who are high risk for challenging behavior, and again, that may have those histories. And finally, the challenge is formidable, but achievable, I believe. However, efforts thus far have been slow and variable with respect to sustained and scaled policy, funding, and implementation and impact. The Act, therefore, is important because we must not acknowledge the clear and strong messages expressed by professional organizations, research, and community and family advocates. We must provide informed and effective guidance and protections in response to the inappropriate use of restraint and seclusion and the potential harm that's associated with them. We must provide minimum criteria or benchmarks to motivate, focus, and evaluate improvement efforts, and we must encourage increased attention to the prevention aspects of supporting the social, emotional, academic, and behavioral development of all students, but especially students who might be presenting challenges. So to conclude, I'd like to applaud and encourage the efforts of the subcommittee in their efforts to prohibit the inappropriate use of restraint and seclusion. And I hope my comments give support to that and substance to this effort. It gives hope to students, educators, family, and community members, and other care professionals who are concerned about promoting student social, emotional, academic, behavioral development, preventing harm, and promote the use of preventative, positive tiered systems of support as a framework for action. I appreciate this opportunity to testify in favor of the Act, and I look forward to further discussing your questions and comments. Thank you.